the one thing that we pride ourselves is that when we develop any of these materials, it's not just a nurse writing them, it's a multidisciplinary approach. So we have physicians, we have nurses, and perhaps uniquely, we usually have a patient voice in the early stage of planning of every material we do.
Welcome to EHA Unplugged, the official podcast channel of the European Hematology Association, EHA. I'm Sarah de Vlieger, and I'm here today with two very special guests from HNHCP, Mairéad and Erik. Mairéad, would you mind introducing yourself?
Hello, my name is Mairéad. I am the Vice-President of the Hematology Nurses and Healthcare Professionals Group, otherwise known as HNHCP. And I'm also a bone marrow transplant coordinator in St. James's Hospital in Dublin, Ireland.
Erik?
Yeah, my name is Erik Aerts. I'm the President of the Hematology Nurses and Healthcare Professionals Group, and I'm nurse manager at the Hematology Department at the University Hospital in Zurich in Switzerland.
Many of our audience will not be quite as familiar with HNHCP, so could you tell us a little bit about, what is HNHCP? Where did it come from? How did it start?
Yeah, HNHCP was established about 10 years ago, and our main focus is educating nurses and allied healthcare professionals like physiotherapists, nutrition specialists, social workers, etc., to educate them in the field of hematology.
Over the years, I suppose we noticed that there was a scarcity of education and information for nurses working in general hematology. The areas like bone marrow transplant are very well covered by other organisations, both general nurses working generally at the coalface with patients with myeloma, lymphoma, CLL, that never referred for specialist treatments. There wasn't much out there in the lines of educational material or information, or even a conference where they could meet and come together and share ideas and learn what was happening in other centres throughout Europe and the world.
Okay, so now you've been going for 10 years. What are the sorts of things, the activities that you do for that part of the community these days?
So important is we are a global organization, and our main focus is our annual meeting. It's a 2-day hybrid meeting, and then the development of educational materials for non-malignant and malignant diseases. And we develop textbooks. And important is for some nurses and other healthcare professionals, the lack of language. We translate our textbook from English in French, Italian, German, and Spanish language. And we have an e-learning platform where people can educate themselves, can do a test, and then we have the EBA accreditation.
So to date, we have developed 7 learning programs on ITP, myeloma, acute leukemias, chronic leukemias, lymphoma, CAR-T therapy and bispecific antibody therapy. And our 8th program is in development at the moment, and we are looking at hemoglobinopathies. And as well as the material textbook, as you said, the e-learning is available in only in English, unfortunately, but is there for individuals to access. But also we have collaborated, particularly with the likes of the CAR-T program, with institutions in the Netherlands and Austria, with translating them locally into their language for use by universities and national societies in those countries so that they can access the material as well.
Within the community, how have these activities benefited both the healthcare professionals but also the patients?
We would think that there's been a very positive reception of them, but we know from the demand for the information, the fact that it's readily accessible both in print form and downloadable from our website, and we know from tracking the downloads that they're being accessed everywhere in the world. But we know that they're not only being used for the education of nurses, but as we said, very keenly for other healthcare professionals, and even in some places are being used as an introduction to certain topics where junior doctors may not see a lymphoma patient or a CAR-T, but they may be seeing them when they come in sick. That's some way of being able to get themselves up to date with what may be involved. The one thing that we pride ourselves is that when we develop any of these materials, it's not just a nurse writing them, it's a multidisciplinary approach. So we have physicians, we have nurses, and perhaps uniquely, we usually have a patient voice in the early stage of planning of every material we do, and then they get reviewed by other physicians and nurses and patient voice that are not involved in the development of the original material. So it has that unique perspective that it kind of covers all remits and facets of the patient journey, which is really important to us.
I mean, that sounds very, not just admirable, but I'm very impressed by the amount of work that must go into that. What are some of the challenges that you are finding in sort of meeting the demands of the community from your standpoint?
I think one of the demands is that you can never produce enough material and produce it quickly enough. There's also, some of the programs need to be updated frequently, but others probably not as frequently, but we really wanted that the material is updated in a timely manner so that it's something that is there and accessible and has developments for nurses that are not able to get to meetings, like the likes of EHA that we're being at this week is wonderful and fantastic. Resources for nurses are limited, and there's not necessarily the funding for them to get to things. With the likes of our online meeting for people in low and middle income countries, and also for Africa and places like that, we offer them free registration to the online meeting so that they can at least access the education.
And important is we are not only focusing on advanced nurses, but also newcomers, so new nurses, new other healthcare professionals coming in the field of hematology, because there's a big need for hematological education, because in a lot of countries, hematology is only a very small piece in the general education. Also due to the expanding field of hematology, it's so important that nurses get a proper education. Because our philosophy is when nurses are not well trained, well educated, they can't inform patients and relatives properly.
It's very, very, very true. You're saying the sort of rapidly developing field of hematology, and the European Hematology Association has also been working on this and has, concerns about what's this going to look like in the future. What do you think that sort of the role of our collaboration should look like in order to facilitate that?
I think it's having an awareness of the needs that are out there, being able to collaborate as we do nicely, even in the likes of this podcast, to say that we exist, that there is a resource out there. We rely the same way that we advertise and say that there is resources available with EHA on our website. That collaboration, to be able to bring it to the attention of physicians and scientists in other organisations, that they can go and spread that news to their nurses, that there is something that they can use and that they can access readily and easily without a huge cost. And the other thing is that even the importance of nurses in hematology needs to be recognised. In some countries still, hematology nursing is not fully recognised as a speciality. And there are places where maybe oncology nurses are having to take on some of that burden so that they can too have access to information and education and hopefully develop an interest in the area. Hematology nursing is more than just looking after somebody with leukemia. It's the hemoglobinopathies, it's haemophilia, it's thrombosis, it's the ITPs, it's the elderly patient who may suddenly be diagnosed with CLL or myeloma on top of other comorbidities, and how do you manage that? And that's why in some of the materials that we do, we look at special populations like nursing the person who's elderly, so that the nurse that's working within care of the elderly can access the material and say, this is a hematology patient, what do they need, what can we do?
What do you think are the sort of the challenges that nurses are going to be facing in the coming years within hematology, but maybe potentially also in general?
I think in hematology is the rapid evolvement of hematology. All the opportunities in most countries, patients have to make decisions for their therapies. I think that's one of the biggest challenges for the future. And on the other hand, in general, I think a very important item at this moment is talking about staff shortages in a lot of centers, in a lot of countries. So we also, as HNHCP, we are trying to motivate colleagues to stay in the field, to educate them properly. So there we see also a role. And also together with associations like EHA, of course, to bring our forces together.
I think another challenge too is, and it's a challenge for EHA as well, we've established ourselves in a way as the experts or the people that can deliver treatments like CAR-T, bispecific antibody therapy, antibody conjugates safely. But now these treatments are expanding out to other diseases. And there's a huge challenge for both medical and nursing because these are going to go on to other areas and we're going to have to lead the education of people in other diseases like rheumatology, dermatology, even solid tumours. And that's a huge challenge and it's a huge implication both on resources and time because we still have to educate our own staff. We still have to have the expertise and the education there. So that's going to be very difficult. There's also a little bit about the role of nursing and transferability of education across countries. I know EHA have been doing an awful lot of work with like medical passports and things like that to have a standardization. It's not going to work quite the same way for nursing. If there could be some way of harmonizing things, it would be great because it would increase potentially work flow and enable maybe retention of staff if they thought that they can then use their qualifications and skills elsewhere if they wanted to, that there's an easy way of doing it without having to jump through an awful lot of hoops with transferring registrations, etc.
And other challenges in the field of hematology is the collaboration between the several multidisciplinary disciplines. So to bring all those stakeholders together in this expanding field of hematology, it's a huge challenge for all organizations, but I think there's an opportunity for a good collaboration between EHA and HNHCP.
So I'm going to play the time machine game. If we could get into a time machine and transport 50 years in the future, what would your ideal situation be?
At the annual meeting of EHA should be nurses involved in terms of joint sessions. Again, this multidisciplinarity between physicians and other disciplines and nurses, I think will be in the future more and more important.
I think very much along the line of what Erik says, a truly collaborative, holistic approach to patient care that involves the multidisciplinary team, the patient, their carers, and the wider support networks, and a recognition that, okay, there are other things out there that will also feed in and help deliver treatment to patients that is accessible, affordable, and near to their home. Now, I'm not saying that it means that everybody has their treatment at home, but being able to provide that care in a holistic, appropriate, patient-centered fashion.
That sounds like a great future.
It would be wonderful.
Well, the other game is the magic wand. What would you use to fix it?
I think a lot of the challenges that we're facing at the moment are to do with staffing and resources and retention of staff, and trying to reduce the burnout rate, the rate of people leaving to go to other professions because they don't see nursing and as being attractive in keeping with this work-life balance that we all like to have. And I think that if you could have a magic wand to make nursing a more attractive proposition, and to be able to develop ways of keeping people's interest and career pathways. But I also think there's a challenge that the role of nurses at the bedside is valued as much as the role of an advanced nurse practitioner.
Yeah. So I absolutely agree. I think we should educate every nurse and nurse assistant, and other disciplines, and also not only inpatient nurses, but also due to future developments in hematology, outpatients setting will be more and more and more important.
Yeah, the role of community delivered therapies is going to become paramount to what we're doing, and to what is there for patients. So being able to do that safely and effectively is really important.
So maybe before we finish, what drives both of you to be so actively championing the nurse and the allied healthcare professional within hematology? What is it that gives you joy?
So my drive is, and I'm working now almost 35 years in hematology, is that to motivate nurses and other healthcare professionals and educate them properly to optimize the care for our patients, and don't forget the relatives. That's my drive in this field.
I think similarly to Erik, he unfortunately reminded me yesterday that I'm about 35 years in the field also. But it is the reward you get when you know that you've been able to improve the working life of a nurse, or what they're able to deliver to their patients locally, that you're able to impact the care that somebody is giving to patients, that you're giving them the resources and the knowledge, and ultimately helping them develop the skills to care for patients and their families, and hopefully enhancing the patient's quality of life by doing that.
And another important item is, here in the western part of Europe, we have a lot of opportunities, but we also focus on the eastern part of Europe, on African countries, on countries in South America, where nurses have often less opportunities also to involve them and to educate them properly. That's also a huge drive and opportunity and challenge for the future.
I think both of you are doing an admirable job, and I would like to thank both of you for coming to talk to us today. It's been a very insightful conversation, and I hope to see more of these conversations in the future.
And we'd also like to say thank you for the opportunity to highlight and promote nursing and the multidisciplinary team within the setting. It's really nice to know that it's valued, and that the collaboration we have with EHA, with the patient groups, that we're able to collaborate to develop and to move the field of hematology forward.
Thank you to our listeners for tuning into this episode of EHA Unplugged. Follow the podcast channels, and we look forward to you listening to the next one.